Assalamu alaikum. Welcome to the third session. So we were discussing the multiple choice question. In the previous two sessions, we discussed some topic related to the MCQs. So let's have a little recap of what we have discussed earlier. So previously in the two session, we discussed the strength and weakness of the MCQs. Then we discussed the types of MCQs. In our MCQs, then we discuss some pathologies of the MCQs, and then we discuss the management in the form of that blueprint and the blueprint matrix, that how we can manage these pathologies. Then we were discussing the technical flaws common to the MCQs, and now we will discuss some examples with the MCQs, with the those common flaws which we when we are constructing the MCQs. So usually we are facing these set of प्रॉब्लम्स सो चलते हैं वहाँ पर और हम हर एक जितनी भी हमारी गलतियाँ होती हैं हमसे ड्यूरिंग द कंस्ट्रक्शन ऑफ एमसीक्यूज तो उन के साथ साथ हम एक एग्जांपल भी डिस्कस करेंगे कि किस तरह जो है हम ये गलती हमसे हो जाती हैं एग्जांपल से मकसद सिर्फ ये है एक तो वो मिस्टेक फ्लास जो है वो समझ में आ जाए एंड सेकेंडली जो है नेक्स्ट अगर हम एमसीक्यूज बना रहे हैं तो एटलीस्ट जो है एज अ टीचर जो है हम ये जो मिस्टेक या ये कॉमनली जो वी कैन से दैट फ्ला है ये हम उसमें से ना करें So let's go towards our main topic. So this is our today topic. We will discuss um, the common flaws which we may have during the construction of the MCQs. So all these mistakes, all these technical flaws, they can be divided into two groups related to the test wiseness and related to the irrelevant difficulty. So initially we will discuss the different flaws which are related to the test wiseness. सबसे पहले जो है जो अक्सर गलती होती है that is that grammatical cues. One are more distractors that don't follow the grammatically from the stem, and this often relates to the use of a or in verbs, nouns, or singular plural. We have an example here. The easiest way to get an update on medical information is books, medical journals, guidelines, the internet, newspapers. We know that in item writer, suppose we are the teachers and we often tend to pay more attention to the correct answer than to the distractors. Grammatical clues are more likely to occur in the distractors. In this example, if you look at test-wise students, that would eliminate the A, B, and C as well as the E as well, because all these options that do not follow the grammatically or logically from the stem, which that is because these all are plural. And if we look at the example, that is the information is. So there is a single option, which is the option D, that is integral. The remaining all they are plural. The books, the journals, the newspapers, and the guidelines. So it can't be these options. So the right option is obviously the option D. The next flaw which we have usually, that is the logical cues, and this one they mostly occurs when one of the options contain all of the other options. Test one students will select amongst similar options, not outlier options. We often have writing difficulty when trying to generate the last option, and often that last option is unrelated to the other options. मिसाल के तौर पर यहाँ पे एक एग्जांपल है and related to this logical cues. Or example is a 20-year-old adolescent attended the AE complaining of the abdominal pain, fatigue, polyuria, polydipsia, and vomiting. On examination, the patient was drowsy and dry. Which of the following changes you expect to see in the blood test. Hypoglycemia, hyperglycemia, normal glucose level, hypocalcemia, and the metabolic alkalosis. In this stream, in this item, if we look at the option A, B, and C, so they include all the logical possibilities. Any patient, a human being, has either increased the blood sugar, or he may have the normal blood sugar, or he may have the decreased blood sugar. So there should be one condition and these three conditions. So the test-wise students knows that the correct answer must be A, or B, or severe is the non-test wise students that spend time considering the answer as the D and E. So as we all know that the patient may, if we may have the hypoglycemia, he might be hyperglycemia, and if these both are absent, so obviously then the person's glucose level is normal. So obviously the option is the correct option in the A, B, and C. The next technical flaws related to test wiseness, that is the absolute term. Terms such as always or never, they are used in options. Many higher level ideas, they are not absolute. Never true and always true, they are often too absolute. Students are expert at arguing the outlier idea that is outside each absolute. So as a teacher, we should avoid such absolute words, and we should substitute these words by such words which require some more judgment than these absolute terms. Like we can use which is the best, which is the least likely, the possible diagnosis, the most appropriate treatment. Like we have an example here. In DVT of the lower extremity, which of the following statement is the most appropriate? 70% of patients will have physical findings on examination. The gold standard test for the diagnosis of DVT is the radiofibrinogen leg scanning. Anticoagulant is the treatment of choice for the distal lower extremity DVT. Pulmonary emboli always come from the lower extremity DVT. In this question, the test wise students, they usually do not select items with the words always or never, like we can see here in the D, that pulmonary may always come from. And instead, they tend to choose items with the words usually or frequently, knowing that nothing is absolute in medicine. Another that commonly flaws which we almost have in our MCQs, that we sometimes we include the statistical um, data, or we can say that the findings of some study of the research articles of the literature and the MCQs. We all know that the statistic are the research findings, specifically the prevalence, the incidence, and the other proportion rates, they vary from study to study. So there is high contradictions and variations among the literatures, among the different writers. There may depend among the different areas. So there may be difference in all these statistical terms or statistical data. So in this question, the another common prize that in the option A, that 70% of patients will have physical findings on examination. There might be true in some situation, but that's not necessary that in every situation, 70% of patients they will have the physical finding on the examination. So obviously, test-wise students, they will also think that this might not be the gold standard rule that yes, always and always 70% patient they will have the physical finding on the examination. There may be 71, there may be 69, and so on. And we also know that when we are expressing the mean of our some studies of our numerical, so we are just writing there the standard deviation, which obviously know that there is maybe variation among patient to patient, among studies too. So that's why we should avoid such statistical data such results are the literature finding in our options. Another technical flaw or mistake which may have during the construction of the MCQs, this is the long correct answer. Correct answer is longer, more specific, and more complete than the other option, than the distractors. And we are often feel we should include more detail in the correct answer to ensure that this is clearly the best choice. This is called too long to be wrong rule, and we should avoid this rule. Unfortunately, test wise students they can use this to their advantage. And so, what is the solution to this problem? As a teacher, we should keep the options similar in length and the level of detail uniform. So we may have that homogeneity in the options. Like if we look at this MCQ, the most appropriate treatment is the parents of a 2-year-old boy reported that he shows enjoying when walking. On examination, the child exhibits a femoral intuition. The most appropriate treatment is. So if we look at these options, A, B, C, and D, here the A option is too much long than the other options. So that's why the test for students they will select the A as the correct option, um, and he will not just go for the B, C, or D. Another technical flaw related to test wise is the word repeats. A word or phrase is included in the stem and as well as it is also present in the correct answer. So students look for words or phrases that are repeated in the question and option. The more repeating, the more likely it is the right answer. Like if we look at this MCQ, a 58-year-old man with a history of heavy alcohol use and previous psychiatric hospitalization is confused and agitated. He speaks of experiencing the world is unreal. This symptom is called. So if just focus on this world, the unreal, and then just focus on the option we have, the depersonalization, derealignment, derealization, focal memory deficit, and the signal anxiety. So if we look at this word unreal, that is also present here, the derealization. So derealization and unreal, these both are the same thing. So that is why students they will just think yes, this is the correct answer because this word unrealization and the derealization they both are present in the stem as well as in the options. The next category of the test wiseness common flaws, this is the convergence strategy. The correct answer include the most elements in common with the other option, and student will select the answer that combines the most element of all the options. The correct answer most likely is the one that combines the most number of the common elements from the other distractors. If all occurs in most of the option, most likely the correct option will contain that word. If a term appears only in one option, then that probably is not the correct answer. We have an example. Oral polio vaccine induces specific active artificial congenital immunity. If you look at this MCQ, we have 5 options in total, and all of them they are different from each other. But if you look at the words, there are 4 words: the active artificial congenital immunity, and so on. The immunity is common to all of them, so we will just delete this mean we will just ignore this one, which mean and then there are the acquired. So we have 4 acquired and 1 congenital. So obviously the correct options should be there in the B, C, D, and E, and not in this one because here we have only 1 congenital and there are 4 acquired. Then if we look at these words, so natural, nature, and then artificial. So we have 3 here and 2. So again, which means these 2 have been also deleted. The correct option is present in the B and C. A is already been deleted because of just the word congenital, which is different from all other. Now, if we look at these A, B, and C, here we have active, and passive, and then active. So active is again 3 terms, and passive is 2. So which means the active is the correct option. So in all these options, the correct option is B, the active artificial acquired immunity. And why I have selected, I was unknown and I'm unknown to the answer, but here we know that active is a word which is 3 times, then the 2 times here is the passive, artificial which is 3 times, then the 2 word natural, acquired which is 4 times, then the 1 congenital, and immunity is common to all. So it means a test wise student will select the best answer, the correct answer, just on the basis of this rule, that the most element in common with the other option. So he will select the option B in this example. So we should be careful while construction of MCQs. Um, and specifically, this is the very common because sometimes we write the correct answer, and then we make some changes in that, and we make the other option as distractors. So now we will discuss the other commonly flaws and mistake which we may have during the construction of CQ, which are related to the irrelevant difficulty. The first one is the options are too long, and not only too long, they are also complicated, and might be there is double meaning as well, double meaning, a double sentence in a single option. So if we look at this MCQ, so the option A, B, and C and E, exactly, specifically the A and E, they're too much long. So the options they are long, and if the students just start reading the reasonable and timely notice, so he may have lost what was there. So therefore, during the construction of MCQs, we should be very careful when we are just writing the answer, which we are writing the option. So that should be not too short. That may be with just like the previous one, where we have the 4 words in a single option, but still it is okay. It's fine, but we should avoid such long sentences like the option A and like the option E. There is another example related to the question related to the as the question is the team of healthcare planners wishes to estimate the prevalence and incidence of AIDS in a particular community. Which of the following is the most appropriate? So they are going to estimate the epidemiological um, data about the AIDS, that what is the incidence of AIDS, what is the prevalence of AIDS. So we have options the A, B, C, D, and E. In this example, if the options they are very long, and not only long, they are also very complicated. And trying to decide among these options require a significant amount of time. Okay, so and not only that, the student should be a good reader as well, because the number of elements in each option they are too much. So this can shift what is measured in this item from knowledge of the content to the reading speed. So if a student is good in reading, so he will be good. While the other students who are not good in reading, so they might have less scoring in such a group of MCQs. The second flaw in this item is that the only option A and B that follow the logically from the stream, while the option C, D, and E they are not directly related to the purpose of the healthcare planners in the stream. And the purpose was that what is the most appropriate strategy, that how they will just estimate the incidence of air, the prevalence air, the epidemiology of the air. So if we look at these 3 options, the option A, B, and C, they all are almost related to some study design, some that strategies that how they will just estimate the prevalence and incidence of that condition. but there is no such information in the D and E, and the data which is being discussed there, the discussion in the D and E, that is just on the other way. So this maybe there should be homogeneity in this option. In this MCQ, there is heterogeneity. So if we look at to the option C, there again just two meanings, or we can say that there are two facts, double facts that need to be judged by the students. Double fact in an option introduce difficulty when one fact is true and the other is wrong. So as a rule, if you need to test the knowledge of two facts, each one should be made into an option. Because if one option is true and the option is wrong, so that will confuse the student that either now I have to take this answer because there is a true content there, and if I have the consider that as a distractor because there is an wrong content as well. So such options should be divided while constructing the MCQ. The next related to that irrelevant difficulty, that is the option that there are in the illogical order. It's a good practice to be consistent in the use of alphabetical order. Whenever options are in spectrum, it is preferable to list them in either a logical order or alphabetically. For instance, numeric options should be listed in ascending, a descending order, and logical order is more convenient for the students, and that eliminate the human bias. So, if we look at this example, the options they are not in a logical order. In arteries, they are seen in the it's mm, there should be an order from brain towards the more superior organ to the most inferior one. Or there may be if this is not there, so we can also write them in the alphabetical order as well. But both cases they are absent here. Option they are not parallel, they are heterogeneous. This is very common when we are constructing the MCQs. The option following a stream belong to different categories. This is one of the frequently encountered mistakes. So this is the example this in illogical order. So a 75-year-old woman complained of severe neck and shoulder pain, and you suspect polymyalgia. Which of the following is the most appropriate? So the response option in this example, they are not parallel. And the option A and B, they are about the clinical features, and option C and D, they are mostly related to the laboratory investigation, while option E is about the management. So there is no connection, no consistency and interconnection between the options. There is no homogeneity and they are heterogeneous. Some options they are diagnosis, some are the symptoms, and some are the treatment. So all the options should be treatment, all the options should be diagnosis, all the options should be symptoms, all the options should be the etiology, should be the causes. So then we can have this a good and very appropriate and proper MCQ. And none of the above or all of the above are option A and B are used in option. This is again another mistake which we commonly have during the construction of MCQ. Just like we can see in the example, chickenpox is caused by the same virus that causes the herpes simplex labialis, the herpes zoster, and the herpetic stomatitis, all of the above, none of the above. So, if in this example, if a student is known that A and B, they both are the correct option, but he is unknown to the C. So, he is already known to the fact that there should be only one correct answer, but he has known that these both are the correct options. So that's why automatically the C option will be also the right because there is all of the above. And if he is known that there is a single best answer, it's a single correct answer, and he is unknown to the herpes zoster and the herpetic stomatitis, so he will just eliminate this option, none of the above, because he is known to that one right answer. The next is the numerical data that not stated consistently. When numeric options they are used, they should be listed in numeric order and in a single format as single terms or as ranges. Confusion occur when format are mixed and when the options they are listed in illogical order or in inconsistent formats. Uh, Here is an example for that in which the numeric data are they are not stated consistently, and the example is a 24-year-old woman delivered a boy with Down syndrome. She is depressed and asks you what is the likelihood of her having another child with a similar condition. Your answer will be 2%, 5%, 25%, less than 10%, and 15 to 18%. In this example, option D and E, they are expressed as ranges. They are not the specific percentages. This is less than 10, it means from 1 to 10, or from 0 to 1 to 10. And this is again, these both are the ranges. So all options should be expressed either as ranges or as specific percentages. As the A, B, and C, they are the specific percentages, and these both are the ranges. So now we will discuss the general guidelines when while writing the MCQ. This was an end to the common mistakes. So this is not the only mistakes which we have. These were some of the some commonly mistake which we have. And as a teacher, we should try to avoid all these mistakes. So include as much of the item as possible in the stem, long stem, short option. Avoid negative phrase item except are not in the lead in. If you must use only with short option. Avoid writing question of the form which of the following statement is correct. Each of the following statement is correct except. So and again this is one of the most commonly mistake which we usually have while writing the MCQs. The option should be written in ascending order, short options to the long one. Top down versus bottom up. Top down mean that knowledge or recall question, that there is easy question, there is a difficult question, there is moderate question. So it means there should be all types of question which may we have there. All the questions shouldn't be too easy, all the options shouldn't be too difficult, and all of the options shouldn't be in the average. So there should be all question, easy question, difficult question, as well as the more difficult question. So that was the end of to today's session. We discussed some summary and some general guidelines. While before that, we discussed the common mistake of flaws which we may have during the construction of the MCQs. Thank you so much to all of you.